So for people who have Medicare, in order for them to qualify for an insulin pump, they need to have what Medicare defines as type 1 diabetes. And their definition is either a positive antibody test, an islet cell antibody or GAD65, or a low C-peptide. C-peptide is a marker of insulin production. So if someone has a low C-peptide or has positive antibodies, then Medicare will cover insulin pumps. If they do not, then Medicare will not cover it. And having said that, there are some people with type 2 who will have low C-peptides, but that's neither here nor there. If someone is deemed non-eligible by Medicare, then they cannot get the traditional tubed pumps such as Medtronic or the Tandem t:slim. However, Medicare does not consider Omnipod to be an insulin pump. Don't get me started on why, but they don't consider it an insulin pump. So people who use the Omnipod do not need to meet the same criteria as those who are using a Medtronic or a Tandem pump. The other requirements that Medicare has for insulin pumps is that they need to be seen every 90 days in the physician's office for the management of their diabetes. And they need to be checking their glucose at least 4 times a day. While those are still, general recommendations for anybody who's on an insulin pump, patients who are using an Omnipod, again, do not need to follow those guidelines expressly for the purpose of getting their pump supplies. Now, having said that, Medicare will cover the Omnipod controller, the PDM, as durable medical equipment, but covers the pods themselves under Part D, under the prescription plan, which means that during the beginning of the year, the patient is responsible for 20% of the cost of the drug, of the pods. And then when they fall into the Medicare gap, the donut hole, then they are responsible for a bigger portion of the cost until they are out of the Medicare gap / donut hole, at which point Medicare will pay for the majority of the cost of the pods. The other difference is that for patients who are using traditional insulin pumps, the insulin is considered part of the durable medical equipment and is covered under Part B as medical equipment. But if they're using the Omnipod, then since they technically do not have a pump as far as Medicare is concerned, insulin is covered under Part D under their drug plan. Does any of that make sense? So the short answer to your question is if someone has type 2 diabetes, they will not qualify for an insulin pump under Medicare, but they may be able to use the Omnipod. There is going to be a cost difference there, though.